Hi, I'm Kathy Galen, Legislative Lady for Signature Healthcare. In this series, we invite lawmakers into our facilities to see how the policies that they enact affect the lives of the residents that we care for. In this interview, Senator Julie Denton visited our Louisville South facility. Senator Denton's been very active in healthcare policy in Kentucky. Here's the interview with Senator Denton. Good morning, Senator Denton. Thank you so much for joining us here today at Signature Healthcare of South Louisville. It's a pleasure and an honor to have you here. We have with us our CEO, Joe Steyer, and our Regional Vice President, Mick Jovanovich. I just wanted to start today with we know that you're on the Healthcare Committee, Health Appropriations Committee, and you've had a deep interest in healthcare for Kentuckians. Very important issue right now with a lot of the changes that we're seeing, a lot of the budget cuts that we've been facing. And I wanted to ask you, with the coming session, do you foresee some of the general funds, the holes in the budget that we're seeing, do you foresee larger cuts coming down the pike as far as Medicaid is concerned?
Well, it's hard to know in advance what we're going to do. The crystal ball gets really foggy quite a bit, so I hate to say we're definitely going to do something one way or the other, but this is a moving target, as Joe and I've talked about previously. It's difficult to cut Medicaid. With this economy, we have more individuals who are becoming Medicaid eligible, and there's an increased utilization of the services with these new people coming on. So it's costing Kentucky more and more, and it's going to be more difficult to cut. I think we're going to have to look at making some changes in order to make those funds go further, making sure that individuals are getting the services that they need and individualizing and customizing each individual's plan instead of everybody gets A through Z. So I think we need to be more targeted in our expenditures as we move down the road in order to make those dollars go farther.
Great, thank you. One other question, accountable care organizations are becoming very popular as far as looking at different pilot programs that are coming about. Do you have an opinion as far as accountable care organizations? Do your colleagues join in the promotion of accountable care organizations for healthcare?
We haven't had a lot of discussion on that. We've been more focused on what they're doing in Medicaid right now with the new managed care organizations coming in and setting up. As you know, we missed the October 1 deadline and for the start date, and now we're targeted to start this Tuesday, November 1st. And there's some issues, some real serious issues that we're hearing from different entities in terms of not contracting with those MCOs. And so we're very concerned about having an access to care issue and not having an adequate network. And I think those are the sorts of issues that we're going to be even addressing during this session, and we may be making some changes to the Medicaid managed care program as a result. So I think that's more of the emphasis right now than anything else.
Along those lines, you mentioned managed care. We know that nursing homes were actually carved out of managed care organizations last legislative session. Do you think that they will actually be implemented in the new managed care organizations?
Well, I didn't think we'd ever get Medicare or Medicaid into managed care to begin with, because legislators have been trying to get that to happen for years, because Passport's been so successful, and there's been a real pushback with each administration in trying to do that. So we were pleasantly surprised when they decided to go in that direction this year. I'm not sure what the administration's desire is with regard to the long-term care piece. From the legislator's position, I think we want to see how well this works and have a track record with that before we throw something else into it, something that's not been in managed care previously. We at least had the Passport model to see how can this work. When it comes to the long-term care model, we don't have that in Kentucky, and I don't know that we would go full tilt on that without there being a pilot project as well.
Great. I hate to ask this question, but it's very obvious. Tort reform has been a huge issue in Kentucky. Media has been covering it, quite a bit lately, and there have been some huge nursing home lawsuits. We know that tort reform is a big issue here. Is it your feeling to introduce tort reform again in the legislature? We know that it has to go through statutory change if that's going to happen, and it's always been an issue in the past. It really has been huge for us recently. What is your opinion of tort reform, your colleagues' opinion, and how can we bring this change to the legislature in Kentucky?
I strongly support tort reform, and when Senator David Williams last introduced the tort reform bill, I said, please let me be the sponsor, and he said, no, it's mine. I said, then I want to be the co-sponsor. I want to see tort reform. I think that in this country we are too sue happy. We have some attorneys in the Republican side as well who are not in support of tort reform, or in a very limited way they could support it. So it's very difficult to get through the legislature. We've done it in the House or the Senate before, only to have it die in the House. And I don't know that there's the composition in the Senate at this point to even push it through.
Thank you. Senator, we know you were recently here for our wonderful Hall of Fame event, and an experience which you had shared with many of us that was just an absolutely incredible experience for you. I know that we all know that you know that Signature is based on spirituality and education, entrepreneurship. I'd like to turn it over right now to Joe Steyer and to have you discuss some of your feelings and the emotions that you had when you were here for our Hall of Fame event.
Okay.
Yeah, first, thanks for coming. I know we love having you in here.
You're welcome.
You come to all our great events, which I appreciate coming. And part of the thing I think working this week, we're doing our CNA clinicals right now, and I think being so close to residents, you realize, I see a big change in the level of acuity and sickness, how important the spirituality part of our company is in these encounters every time we meet with residents today. So talk about a little bit what you saw that day on your visit and the Hall of Fame celebration, what some thoughts were.
Well, when I pulled into the parking lot, I saw a long-term care facility. When I walked in the door, I saw family. The atmosphere was so unbelievably warm, and there was this camaraderie, not just with the staff amongst the staff, but the staff with the residents. This doesn't have any of the feel. The walls can be a long-term care facility, but inside those walls it is not. And I was very impressed. And the excitement of the staff and their interactions with the residents was just overwhelming. It was the best experience that I've had going into a long-term care facility. And most people are like, oh, I never want to go to a nursing home. I never want. Well, my gosh, this was great. And I could see that the residents were happy here. I could see that the staff was happy.
Yeah.
And everybody was on the same page, and it wasn't just a job. This was an experience.
And part of the Kathy thing too, we were working on part of the idea of everybody's being CNAs was keep that servant leadership mindset of the company. And I think when I go to Hall of Fame, I always cry and celebrate. My dad was a customer at the East Little building, and got experience of being a customer, which is different than being a manager. And I always think that the educational pillars here, you're seeing that we probably have more people going through CNA, LP, and conversions and changing lives around education and spirituality. So I've been working for 2 days here. I was telling Charlie, the team is so good here. Fun, engaging. I was doing the electric slide at lunch today with the team, and just the residents were dancing. And I think what we think about is our argument is we want to see more HCBS, home-based services in Kentucky, where we can do like we're doing in Tennessee. We'd love to go in the home and keep the cost down and extend the time in the home. Same time as when people are isolated in the home by themselves, it's not like being part of a community where you have a lot of friends, a lot of community activities. I think there's kind of a stigma there, but yeah, I think we do play it like right, and we have the staff educated and really excited about the company. You see the benefits, what's going on. I think you saw it that night, hopefully, with the process.
I did. I saw family members there who don't even have a family member here anymore. And they're still coming back to participate and to give, because this was a wonderful experience for them and for their loved one. And then other family members of current residents, everybody had this joy. Everybody did have the servant's heart. Charlie was Charlie, and he was a lot of fun.
No question, always.
I mean, he sets the tone, and he does a great job of setting the tone here. So it was a great experience.
So, Hall of Fame is, getting near a decade old. And so we've obviously inducted, I think, about 1,000 people across the country. And it's been, war heroes, Nazi camp survivors, just, original pioneers, pioneering women. So when I walk around those events, it reminds, why I think our radically changing long-term care matters to us so much. I know, Mick, you've been with other companies, you've joined Signature. Any kind of the Hall of Fame to you and what you saw that night?
I think it's reflective of what we have here at Signature and what makes us different from the other companies that I've worked with. And to see the family atmosphere and to see the support of the leadership in the company, I think that also ties in with your CNA outfit here today. I mean, what kind of a company is it where the CEO, the CFO, and senior leadership of the company is becoming CNA certified, working the floors out there side by side with the CNAs? I watched Joe this morning having a conversation with the frontline CNA like they were best friends forever. And you don't see that in other companies. And it's that kind of spirit, I think, that emanates out there to the rest of the company. And as a group, it is one big family. And you just do not see that in so many other companies out there.
Well, part of the comment with your work on the Senate committee, I think there's so many good people that want to make great health care. And the media always covers the bad stuff. But I mean, you're seeing a lot of great health care. Just working with Signature, other competitors, other peer support, I'm seeing a lot of people committed to improving health care in Kentucky. Any comments on what you're seeing out there in terms of Kentucky in general as a healthcare state?
Well, everybody does want good health care. Nobody says, oh, I want bad health care. I want to provide bad health care. And I think everybody's striving to try to do the best that they can for those that they serve. I think one of the things that sets Signature apart is the atmosphere, is the top down instead of the top tier of management's up here. They kind of disconnected. When I walked in today and I saw you in scrubs, I thought, it just emphasizes how unique Signature is.
Thank you so much. Yeah, thank you so much. I think, Charlie's done a great job here. So the leadership team, I think in South Louisville, we had the Senior Olympics in our parking lot last week, and they got beat by Mayfair Manor, and there's residents already practicing for next year, getting ready for the games next year. So I say let the games begin. And I think I want to thank the team here for the great leadership. Obviously, your great service you've done with the Senate, and I think if there's anything we can do to improve healthcare in Kentucky, please call us. And thanks for coming today and celebrate with us. We appreciate it so much.
Thanks.
Thank you, Senator Denton, for joining us today. We really, really appreciate you coming out and all that you do for Kentucky. Thank you.
Thank you.
Thanks so much. Thank you.